Hello, and welcome. Today we're diving into a complex and often misunderstood digestive disorder, chronic intestinal pseudo-obstruction, or CIPO. This condition can significantly impact quality of life, so understanding it is crucial. We'll explore its causes, how it affects the body, its symptoms, diagnosis, treatment, and what the future holds for those living with CIPO. So, what causes CIPO? The answer, unfortunately, isn't always clear. In many cases, the cause remains unknown, which we call idiopathic. However, several factors can contribute to its development. These include genetic mutations affecting the nerves and muscles of the digestive tract, underlying conditions like autoimmune diseases such as scleroderma or lupus, neurological disorders like Parkinson's disease, muscular dystrophies, and certain medications that can slow down intestinal motility. It's a complex interplay of factors that can ultimately disrupt the normal functioning of the gut. To understand CIPO, we need to look at how it affects the digestive system. Normally, the intestines contract in a coordinated wave-like motion called peristalsis, which propels food and waste along the digestive tract. In CIPO, this process is disrupted. The muscles or nerves controlling peristalsis are damaged or dysfunctional, leading to a functional blockage. This means there is no actual physical obstruction, like a tumor or scar tissue, but the intestines behave as if there is, leading to a buildup of food, fluids, and gas. This buildup causes distension and a range of uncomfortable and potentially dangerous symptoms. Pinpointing the exact number of people affected by CIPO is challenging because it's often misdiagnosed or underdiagnosed. It's considered a rare disorder, affecting both adults and children. Studies suggest that the incidence varies greatly depending on the population studied and the diagnostic criteria used. Due to its relative rarity and the complexity of diagnosis, getting precise epidemiological data is an ongoing effort for researchers. The symptoms of CIPO can vary significantly from person to person, but they often mimic those of a mechanical bowel obstruction. Common symptoms include abdominal pain and cramping, nausea and vomiting, bloating and distension, constipation, diarrhea, or alternating periods of both. Many individuals also experience early satiety, meaning they feel full very quickly after eating, as well as weight loss and malnutrition due to the impaired ability to absorb nutrients. Diagnosing CIPO requires a thorough evaluation and often involves a combination of tests. Doctors will typically start with a complete medical history and physical exam. Imaging studies, such as CT scans and MRIs, can help rule out mechanical obstructions. Motility studies, including anteroduodenal manometry and colonic manometry, measure the pressure and contractions within the digestive tract to assess its function. A small bowel biopsy may also be performed to examine the intestinal tissue for abnormalities in the nerves or muscles. CIPO can be classified based on the underlying cause or the part of the digestive system most affected. For example, it can be classified as primary or secondary, depending on whether it arises independently or as a consequence of another condition. It can also be classified as neuropathic or myopathic, based on whether the primary problem lies with the nerves or the muscles of the gut. Additionally, it can be further categorized based on the region of the GI tract most affected, such as gastroparesis, a stomach, small bowel dysmotility, or colonic inertia colon. Unfortunately, there's no cure for CIPO, so treatment focuses on managing symptoms and improving quality of life. This often involves a multidisciplinary approach. Dietary modifications are crucial, often involving frequent small meals, low-fiber diets, and avoiding foods that are difficult to digest. Medications, such as prokinetics, may help stimulate intestinal motility, although their effectiveness can vary. Pain management is also a critical aspect of care. In severe cases, patients may require nutritional support through a feeding tube or intravenous nutrition, TPN. Surgical interventions such as venting gastrostomy or colectomy may be considered in certain situations to relieve severe symptoms. Since the causes of CIPO are often unknown or related to underlying conditions, preventing it can be difficult. However, managing underlying conditions like autoimmune diseases or neurological disorders can potentially reduce the risk. Avoiding medications known to slow down intestinal motility, when possible, may also be beneficial. Maintaining a healthy lifestyle with regular exercise and a balanced diet can promote overall gut health. The prognosis for individuals with CIPO can vary greatly depending on the severity of the condition, the underlying cause, and the individual's response to treatment. For some, symptoms can be managed effectively with dietary and medical interventions, allowing them to lead relatively normal lives. However, others may experience significant disability and require long-term nutritional support. Research into CIPO is ongoing, with scientists exploring new diagnostic techniques, medications, and therapies to improve outcomes for those affected. One promising area of research involves the development of targeted therapies to address specific underlying causes of the condition, such as genetic mutations or autoimmune responses. Gene therapy and cell-based therapies are also being investigated as potential future treatments for CIPO.